Hello and welcome to Acupuncture Professional. My name's Kath Berry and I'm with Luke Rickards. We're here today to talk about safely treating conditions in the later stages of pregnancy, presented by Sarah Budd. Today is the second part in a three-part series about acupuncture and pregnancy. Our first webinar, Safely Treating Conditions in the First Trimester of Pregnancy, is available for you now. And we're looking forward to hearing today about safely treating conditions in the later stages of pregnancy. And the final session, Safely Using Acupuncture in the Final Stages of Pregnancy, Encouraging Labour and Acupressure During Labour, What You Can Teach Your Patients, is also available for you in the members area. It's now with great pleasure I introduce to you Sarah Budd. Sarah Budd is a nurse, midwife and trained acupuncturist. Sarah set up an acupuncture service in Plymouth Maternity Unit in the UK in 1988 after completing a degree in complementary health studies at Exeter University. In 1991, Sarah was awarded the prestigious Churchill Fellowship Award to study acupuncture anaesthesia in China. Sarah was appointed the UK's first full-time acupuncturist midwife funded by the Public National Health Service here in the UK in Plymouth. And it's with great pleasure I introduce to you Sarah Budd.
Hello everybody, thank you very much for listening to me talking about safely treating conditions in later stages of pregnancy. Thank you for the lovely introduction, Kath. So today I'd like to share with you my experience. As Kath mentioned, my background is as a midwife, but I've also had the pleasure of training as a TCM acupuncturist. We know from the history books that acupuncture has been used for many, many years in treating pregnant women, and one of the best known texts by Sun Sum Yao from 652 AD talks about special recipes used for the 9 months of pregnancy. And another text known as the Golden Mirror from 1742 used as the textbook for the Imperial Medical School for the treatment of pregnancy conditions. And I find all this absolutely fascinating and would recommend, if you want to look into it more, work by Sabine Wilms and Elizabeth Rochard de la Vallée. My webinar today is based on my experience mostly using acupuncture in a National Health Service setting. So this is rather different to working in private practice, although I do see patients privately as well, so I have experience of both. But in a hospital setting, we would be seeing patients half hourly, sometimes 2 patients at a time, because we had such a long waiting list, versus maybe 1 hour that you might have to treat somebody privately. There are advantages to this, of course, because no fee meant that we were able to treat the women frequently if we felt they needed it. On the other hand, these women didn't necessarily choose acupuncture, rather they were chosen they were referred to see us by their midwife or doctor. So this changes the treatment slightly. As Kath said, the service we worked in has been established for a very long time. And because it was so popular, there were 3 of us, and you can see the team, Kim Ang, myself and Sharon Yelland. And over the years, we've treated over 8,000 women. So I think we have a fair wealth of experience of using acupuncture in pregnancy. I'm very sorry to tell you that our service was closed last year in November after 24 years of fantastic success. And the reasons were given were due to the changes in the National Health Service funding and also lack of evidence, which I find extraordinary. But however, we hope we can perhaps continue to provide it in a different way. So, things we're going to be talking about today. The audience, you will no doubt have different levels of experience of pregnancy acupuncture. So I hope you'll forgive me if I'm telling you things that you're obviously very well aware of. But for those of you who are new to treating women in pregnancy, we just need to touch on some basics in order to get the whole picture. There isn't enough time to include everything that can occur in pregnancy, but I've included conditions that we saw most commonly that I think you'll be most likely to see in your clinic. So we're going to look at some physiological changes in pregnancy, because obviously these form the picture that we see when we have the woman in front of us with her problem. We need to think about what's different treating pregnant women in terms of how you have your treatment room set up. We obviously have to discuss forbidden points during pregnancy. These were mentioned in the previous webinar, but it's important to include them. And we're going to be talking about treating different musculo-skeletal conditions, constipation, heartburn, varicose veins and hemorrhoids, anxiety and other mental emotional conditions, insomnia, itching in pregnancy and cholestasis, and malposition, especially breech presentation. So physiological changes, well, obviously they're pretty massive. Chong Mai, the great vessel associated with pregnancy, close relationship with the uterus, huge changes after conception. As the menstruation stops, the blood is going to nourish the fetus, and some of it rises up into the chest to make breast milk. So we can see that there are large changes in channels. The circulation changes happen very early, and this increase in blood volume by 30% is to really increase to meet the metabolic needs of the mother and the baby. From the respiratory system point of view, even the lining of the nose is affected, and you will see patients who complain of more problems with things like sinusitis and other symptoms. Women get rib flare as the baby pushes up against their rib cage, and this can be painful but also make them feel quite breathless. Musculo-skeletally, there's an increase in synovial fluid in the joints, and we know that the hormones estrogen, progesterone, and particularly relaxin, a hormone that reduces density of the connective tissue, can have massive effects on the musculoskeletal situation. For the gastrointestinal system, as you may know, heartburn is very common during pregnancy, and also constipation. There are skin changes, changes in the renal system, and when we're taking our case history of the woman, we need to have all this in the background as we understand why she's sitting there in front of us complaining of certain problems. In the case history, we're going to be thinking about pre-existing tendencies, particularly from a TCM point of view. Is this a patient you've known before she got pregnant? You will have a very good idea of what her constitutional makeup is. If you've never met her before, you need to know from her history things like what her periods were like, her lifestyle, all the usual things we tend to ask. If she's had children before, did she have a postpartum hemorrhage? Did she also have heavy periods? You might be immediately thinking this woman has a tendency to blood deficiency. Has she had a history of miscarriages? What's the effect of this pregnancy on her? Was it a planned pregnancy or was it a big shock? There's often a lot of fear surrounding pregnancy. There's also a lot of joy, particularly if it's an IVF pregnancy. There may be some anger if she didn't intend to get pregnant in the first place. Social factors, her age, particularly now that women are having babies later in life, all of these are going to have an effect on her kidney chi. And has she got other children to look after? Because obviously this is going to make it harder work than if it was her first baby. So all of these things we have in the background as we try and build a picture of the woman in front of us. Okay, so when we're treating pregnant women, we might adjust things a little bit. Pregnancy on the whole is a hot condition. So thinking about the temperature of your treatment room, I don't know about you, but I usually have my treatment room pretty warm so that people can relax as they've had their clothing adjusted. But pregnancy is a hot condition, and these women are more likely to want decent ventilation. They may even need to have a fan if it's a hot summer's day. The position that you treat her in is very important. As pregnancy advances, and we're talking about the middle and later stages of pregnancy here, baby, if the woman is lying flat, can rest on her inferior vena cava. This is the big blood vessel bringing blood back to the heart from the legs. And as the baby puts pressure on the inferior vena cava, she can get a quite severe blood pressure drop. So we suggest Never treat a pregnant woman lying flat on her back. She should be sitting semi-upright in a comfortable position, but also keep an eye on her, because even in the semi-upright position, some women can still feel a bit faint. And when I started treating pregnant women, I was quite surprised at what I thought was needle shock or needle reaction. Actually, I soon learned that it was positional. And if a woman starts to go pale and clammy and sweaty and feel very faint on you, you can rectify this very quickly by putting the backrest down, lying her on her side, and she'll very quickly come round as her blood pressure comes back up. It is rather alarming, but it is very important to be aware of it. And I'm much braver now. I don't take needles out anymore. I just change her position, put her on her side, and she's absolutely fine. I personally don't like treating pregnant women sitting in a chair either, for the same reasons, but I know that some people don't have a problem with that. Think about having a bowl, tissues and water. Your patient might have a treatment called hyperemesis, which was mentioned in the first webinar, and this is severe vomiting and nausea of pregnancy, but it can go on the whole way through. So even if you're not treating her for hyperemesis, you may find that she still has a sickness problem, even though it's later in the pregnancy. So just keep a bowl, some tissues and water handy. I suggest that the patients aren't left alone for too long, because they can tend to feel a bit faint, and obviously we don't want a situation where they're falling off the couch or going unconscious on you. Focus on the problem. Pregnant women respond beautifully to acupuncture in my experience, and we don't need to go running off on tangents and sticking in lots of extra needles for various problems that they might have in the past. Focus on the problem they've come to see you with, and just a few needles will do the job. Take care with your needle technique. Again, because they respond so well, I don't feel they need strong reducing techniques. Frequency of treatments, you need to think about what's ideal and what's practical. What's the situation for her getting to your clinic? Has she got other children to have looked after? Where we might want to see somebody 2 or 3 times a week, it may not actually be practical. So you need to actually make a treatment plan. And then there are certain things we need to think about. Red stuff that needs to be referred to the midwife or GP. Persistent vomiting with dehydration is the condition I've just mentioned, hyperemesis. If the woman hasn't been seen medically and been assessed with this, it's important that they check to see whether she's got ketones in her urine. Vaginal bleeding isn't normal in pregnancy at any stage and should be referred to the midwife or GP. Abdominal pain. Some women do get abdominal pain. I mentioned rib flare earlier on. This is a close sort of ally, and it sometimes differentiate. But strong abdominal pain around the front of the abdomen or low in the abdomen does need checking, just to make sure that there isn't anything untoward going on. Fluid leakage may mean that the membranes have ruptured early, and again this needs assessment. Generally feeling unwell. Sometimes women have a silent urinary tract infection, and I will discuss that briefly later on, but it just does need checking out. If they're having tightenings before 37 weeks, which feel stronger than Braxton Hicks contractions, may be accompanied by backache or abdominal pain, this could be premature labour and does need assessment. Itching, especially of the hands and feet, we'll be covering again later on. And headache with visual disturbance and epigastric pain can be a sign of preeclampsia and definitely needs referral to the midwife or GP. We hear a lot about the forbidden points of pregnancy. There is a lot of conflicting advice about this. The main concern, of course, is causing miscarriage or premature labour by stimulating contractions at an inappropriate time. I'll run through the list that is generally agreed upon, and it's taken from ancient texts and various other texts over the years. And when I started using acupuncture back in 1988, a long time ago, and there weren't many people using acupuncture in pregnancy. So I really had to go back to the TCM textbooks and and go on a list that I pulled from various different sources that seem to be repeated, and stick with that, with the proviso, of course, first do no harm. So I thought, well, if I stay away from these points, I should be fine. So just running through them quickly for you. I'm sure you're familiar with them already, but colon 4 and spleen 6 used for induction of labour, so they always the uterus, so they should be avoided until 40 weeks, and not at all if a woman comes for treatment and isn't sure whether she may be pregnant. Spleen 6 on its own from 37 weeks is fine, and it is a point that's used as preparation for labour, which we'll be talking about in the next webinar. It has a softening effect on the cervix. Gallbladder 21 has a strong downward effect and is also used for retained placenta. Spleen 1 is used for stasis of blood in the uterus. Bladder 67 stimulates contractions and can be used to help the position of the baby at term, otherwise with moxa only from 34 weeks to turn the baby in breech position, which we'll be talking about. Bladder 60 moves blood in painful periods with stasis. REN 3 to 6 and the lower abdominal points, and higher abdominal points according to the gestation. So for instance, if you're using points like REN 12 earlier in the pregnancy, you find that you can't any longer use that as the baby gets bigger, from about 32, 34 weeks. Bladder 31, 32 and the other lower points in the lumbosacral area, these are also used for induction of labour and therefore shouldn't be used before 40 weeks. And then you need to think about points such as liver 3 in early pregnancy in a woman with a poor obstetric history. It's a strong chi moving point. So if they had a terrible history of lots of miscarriages or bleeding in early pregnancy, I personally wouldn't use liver 3. In general, don't use strong needle stimulation unless you're trying to induce labour. Beware of positioning anxiety, and remember that pregnancy is generally a hot condition. So for moxa, use with care. It's okay for breech babies with bladder 67, and also a little for backache with cold. And as I said earlier on, there's a lot of conflicting advice about this. Myself and Deborah Betts joined in a debate on forbidden points in pregnancy, historical wisdom. This was published in the journal Acupuncture in Medicine, and you can see the link here. There are medical acupuncturists who don't believe that there are such things as forbidden points during pregnancy. And Deborah and I felt quite strongly that we should respond to this idea and point out that the ancient texts discuss the possibility of acupuncture points having different actions in different stages of pregnancy. So what might be true for the first 10 to 12 weeks of pregnancy may also be true for the final 4 weeks of pregnancy, or are points having different activities at different stages of pregnancy? Are women more susceptible to acupuncture, acupuncture treatments at this time? And also, I always feel that you can always use another point. Why do we need to even consider using these points if we have doubts about them? And contractions cause a lot of anxiety if they happen early on. So it's really worth avoiding. The debate doesn't seem to have finished yet. I notice in this month's Acupuncture in Medicine, that's June 2013, that there is another article talking about forbidden points being used on Wistar rats with no ill effects. Again, it would be interesting to know whether these points were used at different stages of pregnancy, and anyway, what is the relevance of what happens in a rat versus a human woman having a pregnancy. Anyway, as you can see, the debate goes on. Okay, so moving on now, talking about treating conditions in pregnancy. And I'm starting with musculo-skeletal conditions because obviously at this stage of the pregnancy, they're very common in your clinic, particularly pelvic pain, SPD, which is symphysis, pubis, diastasis. It seems to be much more common. Over the years, it's been a condition referred more and more frequently to our clinic, on a par with back pain. And I'm not sure whether this is to do with lifestyle, posture, sitting at a desk in front of a computer, not getting down and scrubbing kitchen floors like they used to, or is it something to do with diet? There is an increase in obesity. Maybe pregnant women are generally heavier and this is having an effect on their pelvis. Who knows? But it's a very common condition and you're sure to see it in your clinics. Back pain, of course, carpal tunnel syndrome is pretty common in pregnancy, and other areas such as knees, shoulders, neck, etc. And then there are women who will turn up in your clinic with pre-existing conditions. For instance, somebody who's had a back injury from maybe a road traffic accident or horse riding accident. And we even saw women in our clinics with fairly major back surgery where they'd had vertebra wired with sort of cage contraptions in their backs. Absolutely extraordinary and very difficult to cope with carrying a baby. And of course the main problem is that they have to come off all their strong analgesics that they tend to be on. So acupuncture has a really tremendous role to play for these women who really have no other support for the pain that they have to endure in these conditions. And the most extraordinary places can be affected. I saw a woman in my clinic called Hannah who had dreadful pain in her toes when she was pregnant. And I treated her and it did help. And lo and behold, she came back in a second pregnancy. No other problems except the pain came back in her toes. So for her, her relaxin hormone was targeting her feet for some reason. So don't be surprised if people turn up with pain in isolated places. And as usual, we can blame the hormones. So, is the pain that she's complaining of an exacerbation of a pre-existing condition? It can start in early pregnancy from the hormonal effects. We tend to think it is due to being the baby, but when these women present in early pregnancy, then we know that the hormones are to blame. Later on, obviously, their posture gets changed. They have the extra weight and the growing baby. Relaxin is the hormone I mentioned earlier on, and also progesterone have a strong effect. In severe cases, they may be admitted to hospital for bed rest, which is jolly expensive. More importantly to me, they're taken away from their family. And they may be offered medication, physiotherapy, and possibly crutches. Okay. So relaxin softens the ligaments, particularly in the pelvis and the symphysis pubis joint and the sacroiliac joint at the back, to accommodate the growing uterus. They have great difficulty getting around and especially lifting other children, and at night they can't turn in bed, so it's affecting their sleep. I think one of the most strong conditions I ever came across was a girl called Natasha, who was in hospital at 13 weeks of pregnancy. Her consultant asked me to see her because she had to have pethidine for the severe pain in her pelvis. That's extraordinary to be on pethidine at that gestation, and of course that's really not good for the baby. She was brought to my clinic in a wheelchair from the ward, and I'm pleased to say that the acupuncture worked very quickly, and she managed to get off her pethidine and get home again. She lived quite a long way from the hospital and managed to continue having treatment as an outpatient. So I really encourage you to, even when it's a case as bad as this, to take it on, because it's just fantastic for helping these women get back some normality in their life. Very important. So from the TCM perspective, well, most commonly the pain is found in the gallbladder or bladder channels, in my experience, particularly backache and sciatica. And impaired chi and blood flow through the channels in the affected area, tenderness, so you can palpate the channels, look at the distribution of the pain, and Asher points are very important for some of these conditions. Is it from overuse? Is it work related? Is there a previous trauma? Is it an invasion of wind, cold and damp? And is there a pre-existing internal disharmony, for instance, liver qi stagnation, making qi stagnation more common, or kidney deficiency? So the pattern differentiation and treatment, with liver qi stagnation, obviously they're going to be a bit more irritable, have a flat mood perhaps, and the main point is liver 3. Kidney yang deficiency, they're going to have more aching and cold in their lower back and they want warmth. So bladder 23. And kidney yin deficiency, low back pain, maybe thirsty, maybe night sweats, all the usual things that you would expect, bladder 23. Now, my treatments here are just suggestions. You will all have your favorites. I'm really just sharing with you the very basics of what we found to be useful in the clinic. And as I said earlier, we were very busy and we tried to very much target our treatment and use the few main points that we felt would do the job. And when I started doing this, I really had to go back to basics with my TCM and say, well, what's really going on here? What's the most important point I can use? And I found that really only a few points did the trick. I didn't have to get too complex. It was absolutely wonderful. So please just take from this that I'm sharing some basics. This isn't the only way to do it, obviously, and you will have your own favourites. Points I found useful for symphysis pubis pain were liver 3, partly for the channel pathway and the effect on smoothing out qi in that channel. Gallbladder 34 I love for anything to do with tendons and ligaments in the body, and spleen 9 because they tend to have a bit of damp and heaviness associated with this quite often, and also the pathway of the spleen channel. I found that these points worked very well for me. Sometimes gallbladder 41 would be a nice distal point to use if they had pain around the side of the pelvis. So pain around the front, it can be just the pubic bone, it can radiate to the groin, it can go around to the back. They'll often complain of a kind of grinding. The pain can be worse when they're walking, worse getting out of bed, better for sitting, maybe better at the end of the day. The results can be very good, and you can start this treatment at any time in the pregnancy. If the pain's mostly in the low back, pelvic girdle area, you can think about points like bladder 23, gallbladder 30. The points, I call them sacroiliacs. They're kind of on the lower outer bladder meridian, but I palpate and feel for the sacroiliac sort of dimple area, and any other Asher points around there. And this can be very effective. The patient will know exactly where they want the needle. I say, oh yes, that's very tender there, and you can feel out on the buttock line, going out towards the top of the pelvis, the iliac crest, and see which points are most tender. But just be careful not to go too low. So don't go down to bladder 32 kind of area. Those sacral foramen points should be avoided because they do have such good effect for induction of labour. So stay away from those until term. So this is a girl called Lisa who had very severe SPD. She started having it from 10 weeks of pregnancy, so you can see how strong the hormones can be. She's 23 weeks in this picture, and you can see her crutches there propped up against the bed, and actually you can just about see the needles. You can see she's also got stomach 36 in, so I expect she had some tiredness as well. Liver 3, you can see gallbladder 34 and spleen 9. And she did very well. This poor woman couldn't even put her pants on because her pelvic pain was so bad she couldn't bend over. So just to give you an idea about really how debilitating it can be. Backache and sciatica are very important, and there's a lot of overlap here between pelvic pain and backache. So you'll see either one or the other, or you'll see both. And what I tended to do was to say, well, which one's bothering you the most? and they'll either say the front or the back. Now, depending on how much time you've got, and whether you feel that it's constitutionally okay to do this, you could use some front points with her sitting up and then put her on her side and do some back points if you feel that that's okay. Or you can focus on the one that's worse that day, and then when she comes back the following week, she says, oh, the front's better now, but my backache seems to be pinging a bit more. So you can change your treatment to the back. You can play around with it. It doesn't really matter. It may be too much to have two-sided treatment in one day. If the pain is mostly on the back, then it's probably the same possible causes, but you may also have a pre-existing back problem. Is it deficiency or excess, stagnation? Is there a sign of kidney yin or yang deficiency? The main point for back pain in pregnancy is bladder 23, and you can use a little moxa if there's cold, but not too low on the back, and they'll respond very nicely to that, particularly in winter. Other points according to the channel involved and the diagnosis. And then think about lifestyle advice. A lot of pregnant women want to carry on and do the same things, but obviously not always appropriate. So they need to sometimes just slow down and make some changes. Think about the chair that they're sitting in, watching TV in the evening or whatever. A case history example of an A&E consultant who saw my colleague Kim. She also had SPD, it's pelvic pain and backache, and she tried physiotherapy and was very sceptical about being referred to acupuncture. Physiotherapy hadn't helped, so she was sent to see Kim at 34 weeks and limped into the clinic, and she got off the couch after the treatment and walked out normally, very surprised. And Kim used gallbladder 30, gallbladder 31, gallbladder 34 and gallbladder 41 and bladder 23. So that's all the treatment she did, and after just one treatment she had a fantastic result. So it's really, really rewarding. And then back to basic differentiation. Use your basics if you think there's if it's a more acute or more chronic, whether it's more stagnation or deficiency, and use points that you feel are appropriate according to what's going on. Carpal tunnel syndrome, fairly common in pregnancy. It's caused by excessive retention of water and sodium, and this puts pressure on the median nerve in the carpal tunnel of the wrist. They feel numbness, tingling, pain. They often complain of pins and needles, and they're offered splints which go from the middle of the hand well beyond the wrist, and they tend to wear them at night, and they can make actually quite a difference. They're worn with Velcro, so they can adjust the tightness of them. The points that we need to think about are to circulate chi and blood locally. So points like pericardium 6, pericardium 7 particularly, and Sanjiao 5 are very good for treating carpal tunnel. The Bashi points can be used on the backs of the fingers around the knuckles. Stomach 36, Susan Lee, is the empirical point of the wrist and will also help shift chi and fluids a bit. And kidney 7, Fu Liu, is a good point to relieve edema systemically. And these tend to be the women who get quite puffy and sort of watery in pregnancy. This can be really debilitating, this condition. It can be actually quite dangerous because they drop things. And I have known women who've, smashed various plates, but, you really want to think about when they're lifting a kettle of boiling water that this can be a real problem. It can also affect their sleep at night, and that in turn can affect their pain threshold and have other effects. So really worth treating. And then maybe just a little bit of gentle advice. If you do manage to help the pain quite nicely and the carpal tunnel improves significantly, just to be careful not to do too much because the pain's gone. I have had women who've had really bad carpal tunnel, done very well with treatment, and then they've come back and said, well, it's back again. When I've asked them what they've been doing, they said, well, they mowed the lawn. So it's not surprising that the pains come back again. And then other areas, well, really you treat, as in anybody who's not pregnant, but avoid the temptation to use your old favourite points. For instance, somebody with shoulder and neck pain, you might automatically think about gallbladder 21, but just remember it is a forbidden point of pregnancy and does have a strong effect on the uterus. Bladder 60 you might think about for backache and sciatica, but again it does have a stimulating effect on the uterus. Keep your technique gentle with your needles, keep your points to a minimum, no strong reducing techniques, and just be aware of backache, to have it in mind that they may have a urinary tract infection, or if they're having tightenings, it's worth asking them if you're treating them for backache, if it isn't a known back problem, just to check that they're not having regular tightenings, because it might be backache with premature labour, just to have that in the back of your mind. And so think about pre-existing conditions, and as I said earlier, acupuncture has a vital role here, as they have to come off their medications when they're pregnant, and can be a real lifesaver for them. Okay, moving on to constipation. This is fairly common, especially in early pregnancy, because progesterone has an effect on the whole smooth muscle of the gut. So it can be common early in pregnancy, but also later on. Obviously, it's difficulty and infrequency of bowel movements. And we know that apart from the effect of progesterone, sometimes there's a psychological component. I've had patients who've had bad childhood experiences at school where they've been locked in the loo, made fun of for making a smell, and then have a real problem with going to the loo anywhere away from home in the future. Iron tablets can have an effect on the bowel habit. Some women tend to get constipated on iron, some actually get loose stools. So it's important to ask what's normal for them. Do you go every day? Some people say, oh, my bowels are normal, and actually they only go once a week because they think that's normal for them. So they will obviously often be prescribed things like fibre gel. Laxatives are unusual because they can stimulate contractions, but most women don't like taking medication like lactulose and fibre gel in pregnancy. Not very nice. So we can do a great job with acupuncture and save them the medication. So what's going on, excuse me, from the TCM perspective? Well, hot foods can dry up the fluids of the stomach and large intestine and dry the stools, or excess cold foods can impair the spleen function of transportation and transformation, and the stools can't move. I love the point Sanjiao 6, Shigu, for constipation. It's absolutely tremendous. It can be used for any background syndrome. So whatever you think is going on from the TCM perspective, I would always include Sanjiao 6. It moves the qi of the intestines and treats constipation. If there's stagnation of liver qi, then liver 3. Blood shu, stomach 36 in choice, or bladder 17. Kidney yang deficiency, then kidney 7. Kidney yin deficiency, kidney 6. And if there's heat in the large intestine, then main point is large intestine 11. You need to think about advice in terms of making sure they're having plenty of fluids, fruit, vegetables and fibre in their diet, and exercise is important. Not too much, but certainly a lot of pregnant women don't do any at all, so they do actually need to get out and get some exercise, some decent walking. And they need to take time on the loo. They actually need to sit and relax, and not be too impatient. A case history to share with you is a woman I saw who had terrible constipation. She was going once a week and was very, very uncomfortable. When I did her case history, I asked her how long this had been going on, and she said for 4 years. So I said to her, prior to that, did you go more or less every day? She said, oh yes, I went every day, never a problem. So I said, okay, what happened 4 years ago? And she said, well, I had glandular fever. And a little bell rang, and I thought, okay. She did also have signs on her tongue of heat. She was also complaining of being very hot. And to me, I felt there was a retention of heat in the large intestine. And using Sanjiao 6 and colon 11, and I think liver 3 as well, I can't remember now, but certainly those 2 points. And she actually had to go find a loo. She left the hospital, and from then on reverted to going every 3rd day, and after her 2nd treatment went back to going having her bowels open every day. So a lovely example of how acupuncture can just switch back a condition that has just come in and made things stick for a while, but very easy to get her back to how she was just by cooling that heat in the intestines. So a good example of being thorough with your case history and saying how long has it been going on, what was happening beforehand, as a major clue to what you need to do with your treatment. Heartburn, another very common condition in pregnancy. Burning sensation from the stomach to the esophagus. Sometimes it makes them sick. Mainly the progesterone and estrogen relaxing the smooth muscle, and also the cardiac sphincter that sits at the top of the stomach and should control the acid in the stomach. But because of this hormonal effect, it becomes slack. And later in the pregnancy, of course, you have the added problem of pressure on the stomach from the baby pushing upwards. They're usually prescribed antacids, particularly Gaviscon, and sometimes they actually get through masses of the stuff. It can happen very early on the pregnancy, but continue throughout, and probably is more common in the later stages, but can be there any stage. It's horrible. It really affected me during my pregnancies, but it does go afterwards, thank goodness. TCM perspective, what's going on? Well, often it's stomach fire blazing or stagnation of food in the stomach. And the main points to think about using stomach 44, tching, which drains heat from the stomach, and pericardium 6, Neguan, and Zusan Li, stomach 36, which harmonize the stomach. You can think about the ear point cardiac sphincter and or the esophagus point, and you can send them home with press needles or seeds to these points, and that can be quite useful when they get an attack of heartburn, and they can stimulate the ear point themselves. And then points to consider about the diet. Avoid, well, pastry seems to be a very culprit here, and bread, and avoid spicy, fatty, fried foods. They tend to know what they can and can't eat pretty quickly. They know the foods that tend to upset them. And may suggest peppermint tea as it's cooling. And a lot of women find that very helpful. There's the ear diagram showing where the esophagus and cardiac sphincter point are. I had a fantastic result with the cardiac sphincter point on a woman who had something, a disease that caused her to have heartburn all the time, even when she was not pregnant. And she had to constantly take a drug to control this. And but she couldn't take it during pregnancy, so she was really in trouble. And I tried all sorts of different treatments, and I really couldn't help her very much. And then I thought, well, I'll have a go at cardiac sphincter and see if it makes a difference. And I used one of these little Pionex needles, and it was absolutely fantastic. We were both delighted with the results, and from then on, I just used the cardiac sphincter and replaced in alternate ears to give the point a rest each week. And she would press this when she got an attack, and it really, really helped. So worth remembering the good old ear points as support between treatments, particularly when you can only see people once a week. It's very useful. Varicose veins and vulval varices. Well, these are very common. People tend to think, well, they're just veins in the legs, but actually they can be really troublesome. This 30% increase in blood volume that they get in pregnancy causes weakness in the valves and blood stasis, It's obviously worse when they're standing for long periods, so it's quite common in teachers, in my experience. And the treatment should include advice to raise their legs as much as possible. So I tell them to do it whenever they can, sitting having a cup of coffee. Of course, they never listen. So if you emphasize to really get their legs up whenever they're sitting down, then you might get some chance that they'll do it occasionally. Sorry, that sounds terribly patronizing, but it's just my experience that they're not very good at putting their legs up. Support stockings may help. And they can get tremendous pain from this. I think the worst case I saw was actually a teacher, and her legs were almost black and blue with terrible blood flow and very, very painful. To a lesser extent, the women can just feel that their legs, their veins feel very distended, they're sore, they can throb, and they're really aching. Vulval varices are due to pelvic congestion and impairment of blood flow, and they're really varicose veins around the vulva or in the vagina, resulting in pain, aching. They get a dragging sensation as though something's falling down, worse standing and lifting, and can make many daily tasks very difficult. They do usually resolve after the birth, luckily. Just to be aware of a red flag, make sure that you are checking for possibility of deep vein thrombosis or thrombophlebitis. If you suspect this, they're going to have pain in their calf, tender, swollen calf, particularly with dorsiflexion. If you get them to point their toes back towards their knee, they get a lot of pain in the calf, then you should be suspicious. It can be definitely diagnosed by ultrasound scan. It is potentially serious because it can cause an embolism or a clot traveling to the lungs, heart or brain. And with thrombophlebitis, which is a clot in the superficial vein, they get very tender reddened area, and this also needs medical referral. So just to have that as in the background. Closely related, hemorrhoids or piles. These are congested enlarged veins in the rectum. They're often associated with constipation. They're very common after the birth because of the pressure of pushing the baby's head out past that area. And they get pain, itching. They can have bleeding and a lot of discomfort. Dietary advice is important, of course, because it'll help the underlying constipation. And they may be prescribed topical creams to put on the hemorrhoids, such as Anusol. So what's going on from the TCM point of view? Well, very often it can be the inability of the spleen to raise qi. It can be qi stagnation, or there may be heat in the blood or damp heat, which usually presents with bleeding and or itching in hemorrhoids. And with qi stagnation, they'd get a lot of heaviness, aching and swelling. And as I said earlier, you need to address any underlying constipation. You can treat them once or twice a week if possible, and then put them onto maintenance as they improve for any type of varicose vein treatment. And if they felt that they were managing much better, I would put them on SOS, which means call me if you need me, come back, but otherwise I wouldn't keep them coming. They do tend to get worse as the pregnancy progresses because of the baby growing and putting more pressure. But the treatment usually helps the discomfort a lot. But the veins may not go down. They often do say they do seem to go down a bit, but they won't disappear usually until after the birth. But the pain will go down, the swelling will go down, the throbbing will reduce. I do have a little joke with them that not to tell anybody if they're better, because they might have to go back to doing the washing up and standing up at the sink. As I said earlier on, advice about raising their legs when they can, when they're sitting. Suggested points: if it's spleen qi sinking, you can think about do 20, stomach 36, bladder 57 is empirical point for hemorrhoids. If it's damp heat in the large intestine, colon 11, again bladder 57 is great for hemorrhoids, and you can think about spleen 9 as another possibility. And my little favourite treatment is liver 3 to help move the stagnation, spleen 9 for the sort of dragging heaviness that they tend to feel, and gallbladder 34 is a good tonic point because it's got that lovely strengthening on tendons and ligaments, and to me it tends to pull the support for the veins and tends to sort of get the blood back into the system a bit. But of course you do need to differentiate what's going on and use whichever points you feel are most appropriate. For vulval varices, you could think about using stomach 13, chi-hu, which is just below the clavicle, force and lateral to the midline. Be careful, obviously, because it's one of these points that needs a shallow, oblique introduction because of the lungs nearby. But it's a very good point for pelvic congestion and that heaviness with vulval varices. Okay, so we've got points on the front and back here. Again, you may need to think about positioning. This is a picture of Lisa, who you saw earlier on, who also had hemorrhoids apart from her pelvic pain, and here she's having treatment to the back of her legs, got bladder 57 in here, and gallbladder 34. And she's lying on a Putnam's couch, which looks like this. As you can see, it's a nice big hole cut out of it to put her pregnant tummy down, and there she is lying on it. So baby's gone down the hole, she's got pillows, she's really comfortable. They absolutely love this. Unfortunately, it's rather expensive, so unless you're in a multi-bed clinic, or you're treating a lot of pregnant women, or you're not treating a lot of pregnant women, you may not want to invest in one. But I can tell you it's very popular. They always want to take it home. And it's fantastic for getting to points on the back of the legs, as well as getting to points. You can get to points like liver 3 if they're dangling off, their foot's dangling off the edge of the couch, gallbladder 34. And obviously back points as well if you're treating pain. Or you can lie them on their side and do points on the front and back if you can reach them. So just to show you, there is actually something on the internet. I think it was called Holo. It's like a Lilo that, which is much, much cheaper. I've never tried one, but it was invented by a pregnant woman who wanted a similar thing to be able to lie on her tummy. So you can investigate that if you want to look for something. Anxiety and depression, well, fairly common, increasingly common it seems. And but never really heard of antenatal depression too much in the past, but we started getting referred patients with this more frequently. Emotional, well, pregnancy is emotional anyway. The hormones, I remember crying just because a bird flew across the road when I was pregnant. It's extraordinary how they can just overwhelm you. But more seriously, it is a life-changing event. It's one of the biggest things that can happen in life, the most wonderful. But for some women it's not such a happy occasion and can be associated with all sorts of terrible experiences from the past. It may be a patient who already has anxiety issues and is terribly worried about how she's going to cope with the responsibility of looking after a baby. Has she got a previous history? Is it an IVF pregnancy, much wanted baby, longed for many, many years? Will it be okay? Has she got previous postnatal depression? She worried about getting that again, and if she's had severe postnatal depression or even puerperal psychosis, this can be very alarming if she thinks that she may end up back in hospital again. So again, your case history is very important to give you some clues. I think the most severe case I came across was a patient with extreme anxiety from a previous trauma where her brother had been killed in an industrial accident in a boat factory and actually been blown up, and she couldn't get images out of her head. It happened about 3 years previous to the pregnancy, and she was coping quite well, but when she got pregnant, presumably the hormones or whatever just brought everything back to her, and she was in a terrible state. Pleased to say that the acupuncture was absolutely fantastic for her, but I did need to see her weekly throughout the whole pregnancy and afterwards for a while. But she did do very well, and we both wondered what would have happened to her if she hadn't been able to have acupuncture. So important to support, and particularly in cases like that. The main organs usually are the heart and liver, but not always. And these are just some different point suggestions for you if you think whichever pattern you feel is dominant, or of course it may be a combination. So some point suggestions there for you. And think about whether you need any other support. We have a clinical psychologist at the hospital who used to do some counselling for our pregnant women, and it may be that they need something more than just the acupuncture. So it may be worth liaising with her midwife if she's to see if she's already having some sort of psychological support, particularly in cases where there's been previous, if the patient herself has been abused as a child. This often brings up all sorts of problems in pregnancy because of having the responsibility for their own baby, and a lot of them worry that the same thing might happen to their own child. So it's important to get other professional involvement here. Insomnia is a common problem in pregnancy and important to address because they're exhausted. Pregnancy itself is exhausting quite often, but particularly before the birth, they really do need their energy levels to be in pretty good condition. There's a potential for excess heat patterns of the heart and liver in pregnancy because of the extra heat that's involved in growing a baby. And also deficiency patterns of the heart, liver and kidney for the demands for producing blood and chi for the fetus. And they can have spleen problems because of the worry and the spleen's role in chi and blood production. So needing to look at what's actually going on. Is she having difficulty falling asleep? Maybe some palpitations and anxiety that might hint towards heart blood deficiency. If there's some spleen involvement, it would be as above, but they might also have appetite issues. With heart yin deficiency, they're going to have more dream disturbed sleep, restless type of sleep where they can't get off to sleep, but they also wake up a lot. And with liver yin deficiency and liver yang rising, these are the women who tend to wake in the early hours and can't get back off to sleep. They might also be quite irritable and possibly have headaches. So there's some point suggestions there for you as well. Itching in pregnancy. This comes under the category of red flags in pregnancy because there is a condition called cholestasis, which occurs only in 1 to 2 pregnancies in every 1,000, but it's important to be aware of it because you may be the first person to come across the woman. She may be an old patient of yours who sees you regularly and happens to turn up in your clinic saying, well, I've started itching terribly, but she hasn't told her midwife or GP. The problem with cholestasis is that there's a raised incidence of stillbirth, so it's very important that it gets diagnosed. It's caused by an increase in bile salts under the skin and causes tremendous itching, particularly of their hands and feet, but it can be anywhere. Excuse me, there's a higher risk of recurrence in future pregnancies, and there's also an increased risk of postpartum hemorrhage with this condition, so it is important to know. It's diagnosed by a blood test by the GP or midwife, and they will look at liver function tests, bile acid and bilirubin levels. Depending on where you live, this test might take a few days to come back, so they might not get a very quick result and diagnosis. And medication is available for the condition to calm it down. But if they're worried when they keep repeating the blood tests that the levels are still too high, they may consider inducing the labour early to reduce the risk of the baby being stillborn. So it's important to be aware of it. And please, if the patient hasn't told anybody else about the itching, can you make sure that they get an appointment with their GP or midwife as soon as possible? You can still treat them to help the symptoms, but they must have a diagnosis made and be monitored for the rest of the pregnancy. The normal flow of bile in the gallbladder is stopped or slowed because of the hormones with this condition. There's a suggestion there might be a genetic component, because it does seem to be more common in families. It can be particularly repeated from mother to grandmother, etc. It's more common in the last trimester of pregnancy, and it usually goes within a few days of delivery. So that's just to be warned about cholestasis. Or it may just be a heat rash. So we know that itching can be caused by wind, an attack of wind, and that's that spreading kind of itching that moves from one place to another. If there's heat involved, there's going to be redness and they feel hot, and sometimes there can be swelling and oozing. So you can get sort of skin conditions like eczema, which are exacerbated by pregnancy because of the heat, the extra heat with pregnancy. It can actually make a pre-existing eczema much worse. And I have seen a woman who was so bad that she couldn't sit back against a chair. She couldn't wear a bra. She couldn't bear having clothes on. She had to wear loose shirts, and was very, very depressed by the effect on her eczema. But the acupuncture worked wonders and improved the quality of the rest of her pregnancy tremendously. She managed to get her bra back on and could sit comfortably, etc., etc. So good results. If it's just itching, then you can look at whether you feel there's some blood deficiency causing wind generation or blood heat. Look at tongue, pulse, symptoms, whether she feels hot, etc. And there's some point suggestions depending on which type you think is going on. Colon 11, a nice point for cooling blood and eliminating wind and itching. Do 14 expels wind in the skin, and if there's some damp, you could consider perhaps spleen 9. Have actually seen eczema in women that does become quite oozing, and you do need to use your points for damp. And bladder 17 if there's blood deficiency. All the usuals, really. So moving on to premature labour. This is defined as labour before 37 weeks. 37 weeks the baby's lungs mature, and really 37 weeks can be considered term. We tend to think of term as 40 weeks. I'll be talking about this more in the next webinar when we're talking about induction. But really term is when the baby's mature. From 37 weeks up until 42 weeks is term, really. Sometimes beyond. But premature labour can occur in about 10% of pregnancies, and the problems are mostly to do with the baby and are associated with low birth weight, causing hypothermia. They can't thermoregulate. They drop their blood sugar, and it goes into a vicious circle because they burn up their blood sugar trying to keep warm, but being cold uses up the blood sugar, so get into trouble. And also they can have breathing problems because the surfactant in the lungs isn't mature enough to allow their breathing to be normal. And premature labour is responsible for a high percentage of neonatal deaths. There may be maternal medical causes such as a urinary tract infection, and so this is important to treat. So from the acupuncture point of view, it's important to recognise it. There was a study by Sway and Lai in 1974 on acupuncture and labour for analgesia, and by chance they found that spleen 4, Gong Sun, was found to stop contractions. It's the confluent point of Chong Mai, Sea of Blood, and it has an effect on the uterus, calming and relaxing it. It regulates the penetrating vessel and is used for pain and distension in the upper or lower abdomen, and it calms the spirit. And I came across a study from the Auckland University of Technology on premature labour and acupuncture, and they differentiated the main causes as being kidney yang deficiency, spleen qi deficiency with damp, and liver invading spleen. It was only 12 women with premature labour, but they used points including Bai Hui, do 20, and 91% of the patients actually went to term, so they got good results from that study. So if in doubt, I mean, they really must be in hospital with premature labour, but if you're worried about it and you get a chance to treat them, then I would suggest spleen 4 as being the main point, plus do 20, which will sort of raise qi and support, and points obviously for anxiety, so things like shen men or ear shen men, because it's very, very worrying for the woman if she's going into labour early. And any urinary tract infection should be treated. But be aware that it can be asymptomatic in pregnancy, so they don't have all the usual signs of burning, stinging, urination frequency. It can be a silent urinary tract infection. And you may remember earlier on I mentioned about generally feeling unwell. I tend to see if they can get an appointment with their midwife, and well, if it was possible in the hospital, I would actually send their urine off, but you may not be in a position to do that. But they should actually have a urine sample sent off to make sure that they haven't got a urinary tract infection, because it is associated with risk of miscarriage, premature labour. And there's also a risk of an ascending infection to the kidneys, because the ureters are dilated by pregnancy, so it's possible for any infection to travel up them to the kidneys, and then you're in trouble, because you've then got a renal infection with fever, abdominal and back pain, frequency and painful urine, and these women actually need to be admitted for bed rest and antibiotics, which may even be intravenous, because it's very serious, and the baby has to be monitored. So from the TCM perspective, if it's not a urinary tract infection, then it's often qi and or blood deficiency for the prem labour. So treat that and see if you can help calm things down. Okay, so moving on now to breech presentation. I want to spend a bit of time on breech because it's something that I get asked about quite a lot. It's a very common thing for them to be some misunderstanding about breech presentation and how to treat it. So I just thought it's worth talking about the different types. There's the flex breech, where the baby's got its legs folded. You can see the or complete breech. A frank breech or an extended breech is the third picture, where the baby's got its legs sort of splinting its body. An incomplete breech, which is where it's got one leg up and one leg down, or a footling breech, which is the fourth picture, where both feet are coming first. And they all have different implications for vaginal birth, but it's just important to recognise that there are different types. And from the moxibustion perspective for treatment, in my experience, the complete breech or the incomplete breech or the footling breech are the most likely to turn, because they sort of kick themselves round. You can see their little foot can push round, push themselves off. Whereas with a frank breech, they don't get that advantage, and they don't tend to turn so easily. So those are the different types of breech. 2 to 4% of pregnant women will have a breech at term, so it can have implications. And in the UK now, all breech babies are delivered by caesarean section, unless they're undiagnosed and they're already in labour. A lot of babies start the first part of the pregnancy breech, and actually 20% of babies will be breech at 28 weeks. It doesn't matter at that stage, because they're still spinning around and they've got a nice big swimming pool to turn in, but it just becomes more of a problem later on. So the ideal for us to see them as acupuncturists is at 34 weeks, because at this stage they're less likely to keep turning around into a different position. They've still got room to move, and you've got time. If they're offered external cephalic version, which is where the baby's actually turned by the doctor from the outside. He manually manipulates the baby round through the mother's abdomen. It's not very popular, it's pretty uncomfortable, but it will be offered in many hospitals, and it's usually offered at about 36 weeks. So if you started your moxibustion course at 34 weeks, they've got a couple of weeks in hand for your treatment to work in order to be able to avoid external cephalic version. And the caesarean section rate is creeping up generally due to increased litigation in obstetrics, but also because more breeches are being delivered by caesarean section. So if we can do something to help reduce the caesarean section rate, then it's very good for our clinic. It's also very important for the women, because once they've had one caesarean section, they're very likely to have more. There was a webinar on turning breech babies with Bex Armstrong, myself, Deborah Betts, and Ineke Vandenberg, which was hosted by Acupuncture Professional, and we had a great time. It was a really good webinar. So if you're interested in breech, then contact Acupuncture Professional. From the TCM perspective, we're trying to restore kidney equilibrium. Bladder 67 is a dynamic point at the end of the bladder channel, Jingwell point, and stimulating it has a regulating effect on the chi of the kidney channel. We start to use bladder 67 at 34 weeks, ideally, and you can see pictures here of women in China sitting with bladder 67 and moxa. It's not how we do it, but I took those pictures in China. Absolutely fantastic. The treatment is to, well, the way I do it is to have the woman up on the couch, sitting up nice and comfortably, with her legs stretched out before her, nice loose clothing, and sit at the foot of the couch and stimulate bladder 67 bilaterally. So you're using both points at the same time for 15 minutes. Teach their partner or their mum or a friend what to do, and get them to carry on doing the treatment. Need to come and see you every day. So it's very easy to learn. I do the first 5 minutes, and then I hand over the moxa sticks to whoever they've brought with them, and make sure that they're happy. Remember that we're very used to using moxa, so you just need to keep an eye, because if people start talking, they very often the stick will start wandering away from the point. So make sure they're actually reaching the right place, and also that they feed back to the woman about whether the heat's acceptable or not. Our success rate's about 60%, and that's in line with the research that's been published. So it would seem there's now a growing number of papers. It seems that we're turning about 60% of babies at 34 weeks. Now the figure goes down if you start treating them later on, 36, 37, because the baby's bigger. But if you can get them at 34 weeks, it tends to be about 60%. And you need to think about things like compliance. So are you going to give her smoky moxa or smokeless moxa sticks to take home? And I have had stories of women going out to the garage and doing their moxibustion out there because they had smoke detectors in their house. I tend to advise them to stop if they think the baby's turned. This is because I was taught that at college, and also I read it in a text. But I know that Deborah Betts in New Zealand tends to carry on treating for the whole 10 treatments. So you can take your pick, or you can try and see what works best for you. There's some suggestion that the physiological mechanism at work here is that moxa to bladder 67 increases corticosteroids in the mother, and this will increase fetal movements, and also placental estrogens and progesterone changes, causing increase in fetal movements, and an effect on the myometrium, the actual muscle of the uterus, allowing the baby to turn. I feel that most babies will turn about the third or fourth treatment if they're going to turn, and they often describe a sensation of warmth travelling up their leg. They don't know where the bladder meridian runs, but they will often describe it running in that pathway, and as the treatments go by, the warmth gets higher. It's a fantastic treatment to do. It's so simple, and I think it's well worth, if you're interested in treating pregnant women, perhaps seeing if you can give a talk about moxa for bladder, for breech, because most maternity units are desperate to reduce their cesarean section rate, and it's a very cheap treatment as well. However, there are some contraindications which we've listed here for you. Multiple pregnancy, you don't try and turn twins, or certainly not triplets, but don't try and turn twins. I get contacted about this a lot by practitioners who I've either taught in the colleges or from conferences. They email or phone and say, I've got a woman with twins and the first twin is breech. You don't moxa twins. It's a bit complicated, but it's to do with lack of room mostly, but also heads getting locked together, the position of twin 2. If twin 2's breech and twin 1 is cephalic, you don't need to worry, because when twin 1 is born, twin 2 will usually swing round to cephalic as well. So it's all to do with mechanisms, but basically it's a no-no. Multiple pregnancy, don't moxa, regardless of which one's breech. It doesn't matter. You don't use moxa for breech with placenta previa. This is where the placenta has planted itself in the lower part of the uterus, and there are 4 grades of placenta previa, and the first 2 grades are very severe, and the woman can have a catastrophic hemorrhage. So you don't want to do anything that stimulates that placenta, which is sitting over the cervix in the wrong place. Polyhydramnios is where there's too much fluid. There's an increased risk of ruptured membranes and cord prolapse, so you don't use moxa for breech. Oligohydramnios is where there's too little fluid around the baby, and the baby can have some structural abnormalities, and there isn't enough swimming pool for the baby to turn, so you don't use moxa. If you know there's an abnormality of the uterus or pelvis, and the women usually know about this from their ultrasound scans in pregnancy. Some women have a what's known as a septum. They have a bit of tissue that comes down in the middle of their uterus. So they have like it looks like a heart-shaped uterus, a bit of muscle that obtruses down into the middle, and the baby will settle in one side or the other, quite often in breech because there isn't enough room. But you don't try and use moxa because you can cause severe problems with uterus. Hydrocephalic fetus, where the poor little baby has an abnormally enlarged head. History of antepartum hemorrhage, if there's been any bleeding in pregnancy. Very often they don't know the cause, but you don't want to do anything that might provoke further bleeding. If they've got a history of premature labour or premature rupture of membranes, again, that uterus shouldn't be stimulated. Preeclampsia, this is a condition where they have high blood pressure and other problems which can very quickly escalate into eclampsia and fitting. Don't do moxibustion for breech for these ladies. If they've got rhesus antibodies, this is with women who are rhesus negative and have actually started making antibodies against the baby, again because of the risk of increasing fecal movements, possibly causing a slight hemorrhage. You can make the antibodies worse, so we don't do it. It's okay to use moxibustion for breech with a rhesus negative woman if she hasn't got any antibodies, so you can check this from her notes or discuss it with her midwife. If you're not sure, just contact the midwife. And as a super precaution, a previous caesarean section if it's within the last 2 years, and this is because of the effect on the scar. Some women do have problems with caesarean scars, and if you did moxibustion for a breech and there was a lot of movement and you caused scar problems, or let's say scar problems happened, the finger may be pointed at you, so it's really best to be safe and not do it in those situations. Some research behind breech, and again, if you're giving a talk, it's quite important that you have this evidence, because it's the buzzword nowadays. Everybody wants to know what the evidence for something is. There have been a lot of trials by Cardini, an Italian doctor, which you can search, and he came up with similar outcomes to us with 60% success rate. Ineke van den Berg in Holland did a fantastic paper published in Complementary Therapies in Medicine in 2010, and she used a modelling approach to look at cost effectiveness of Moxa to bladder 67 compared to the usual care. And it's a rather complex research paper, but it's worth battling your way through it. I've plucked out a few points from it. She found that the mean cost saving per woman was €451 by using Moxa, but that you only needed to treat 7 women in order to save 1 caesarean section, and that you only need 16% of women to comply to this treatment to start saving money. So in terms of arguments and politics and discussing with medics and maternity units, this is a sort of paper that will back up your cost effectiveness argument. In terms of RCTs, the most recently published one that I've come across was in Acupuncture in Medicine 2013, just a couple of months ago. There's the reference for you on the screen, and it was a multi-centre trial, randomised, using 406 women in 3 groups. One group had true moxibustion to bladder 67, another group had a moxa to spleen 1, which they called a sham point, or they had usual care, so in other words, either no treatment or ECV. And at term, the babies were head down for 58% of the moxa to bladder 67, but only 43 and 45% for the other 2 groups. So that's a good study demonstrating the benefits. And if you calculate how many women that saved from having a caesarean section, then you're starting to come out with big figures financially. And I'm saying this again because it's important as an argument in terms of convincing people why you should be allowed to treat all their breech babies with bladder 67, because they're very interested in the money nowadays. For myself, I'm much more interested in the woman and the consequences for her. It's very disheartening for them when they have their lovely pregnancies going along and they get to 34 weeks and they've written out their birth plan. They've chosen a nice natural birth, maybe with acupressure or a water birth. They don't want lots of intervention, and everything's going really well. And then the midwife puts their hands on their tummy and says, "Oh dear, it's breech," and the whole world falls apart. To be able to offer bladder 67 moxa, simple technique, they're absolutely delighted to have something that they can actually do for themselves in this situation, and it's very important and empowering for them to have a treatment such as this. I hope I'm making a good argument. There are other published studies for breech, so if you're familiar with literature searches, you can actually build up a nice little catalogue of studies to go and discuss with your maternity unit, your midwives, give talks and give a good case for why it should be offered. Okay, so background reading. My favourite book, if you're wanting to know more about treating pregnancy with acupuncture, is by Deborah Betts, good friend and colleague in New Zealand, and it's called The Essential Guide to Acupuncture in Pregnancy and Childbirth. It's published by the Journal of Chinese Medicine here in the UK, and it's a great book which covers the whole of pregnancy and postnatal care. There are other books there on the list for you. You can pick and choose which ones you like, your style. The only thing I would say about Ansgar Romer's book, it's Medical Acupuncture in Pregnancy, and he is one of the chaps who doesn't believe in forbidden points. So you will find in his book points suggested for treating certain conditions which we in the TCM world would consider to be forbidden. So just to point that out to you and urge caution there, really. From the point of view of research, the Acupuncture Research Organisation of the British Acupuncture Council is called ARC, ARRC. I actually wrote some briefing papers for them Obstetrics 1 is on nausea and vomiting in pregnancy, and obstetric 2 is on treating all the other conditions. And I have actually summarized all the research studies. So in table form, you can see the type of study, whether it was randomized controlled trial, the sample size, the type of acupuncture used, and the outcomes. It was updated in 2011, I think, 2012, can't remember. So it's not completely up to date, but it will have an awful lot of the studies on it, particularly for breech. And things like pelvic pain and other conditions. The British Acupuncture Council, there's the website, also publishes research fact sheets. They've tended to do away with the briefing papers now, so they're a bit difficult to find. But the fact sheets summarize the latest research, and they exist for titles such as obstetrics, childbirth, and pregnancy. And on those, you will find a nice summary of the most recent studies. I'd like to also mention acupuncture for childbirth teams, which exist here in the UK and maybe in other countries. These are groups that have been set up by acupuncturists. They're not midwives. The first one was in Oxford, and they are an amazing group. They had a GP amongst them who would teach them obstetrics, so that they got good knowledge of Western physiology of pregnancy, etc. And they had an honorary contract with their local maternity unit, which was actually the John Radcliffe, which is a big maternity unit in Oxford, and do great work. And because they have teams, they can support each other in terms of providing acupuncture for birth, but also during pregnancy, treating conditions. So they have great support from each other, and they have continuous professional development lectures. So they're really up to date with what's going on and very well informed about midwifery care and pregnancy care in general. And I think it's important for patients to have a perception of people with experience. I know that pregnant women like to ideally see midwives who do acupuncture, but there's very few who actually do that. So they will tend to want to go to acupuncturists who've got experience of treating in pregnancy. And you can find them on the internet. And there are, if you're in the UK listening to this, there are several others, and they're springing up all the time actually, in Buckinghamshire, the Northwest, Yorkshire, London, Hertfordshire, and Brighton and Sussex. I urge you, if you're considering doing a lot of pregnancy acupuncture, to consider joining a team such as this, or even if you're in another country, to think about setting them up. Very important if you're going to consider offering acupuncture for birth, because of needing to be on call for 24 hours. Okay, so that's the end of my webinar for now. I am very grateful to you for listening to me. I hope it's been helpful. Please remember, this is just my take and general advice on what I've found useful, and I'm happy to be contacted if you have further queries or via acupuncture professional. Thank you very much.
And thank you, Sarah. Again, as mentioned, that was part 2 of a 3-part series on acupuncture and pregnancy. Our first part being safely treating conditions in the first trimester of pregnancy, and our follow-up series being safely using acupuncture in the final stages of pregnancy, encouraging labour, and acupressure during labour, what you can teach your patients. So thank you again, Sarah. You've been listening to Acupuncture Professional, and we look forward to you joining us again. All the best.